Meniere's disease is a chronic disorder of the inner ear that causes sensations of spinning, vertigo, hearing loss, pressure in the ear, tinnitus, and/or ear infections. An episode can last anywhere from 20 minutes to 4 hours, although some have been reported for longer amounts of time. Currently, treatment options are being explored as each patient may respond slightly different to treatments. A more official definition from Mayo Clinic is, Meniere's disease is a disorder of the inner ear that causes episodes in which you feel as if you're spinning, also known as vertigo, and you have fluctuating hearing loss with a progressive and ultimately permanent loss of hearing, ringing in the ear, also known as tinnitus, and sometimes a feeling of fullness or pressure in your ear. In most cases, Meniere's disease affects only one ear. Once again, 4 primary factors of this disease are episodic vertigo, fluctuating hearing loss, oral pressure, and tinnitus. There is a connection between something called endolymphatic hydrops and Meniere's as well. Endolymphatic hydrops are swelling of the fluid-filled tubes within the ear. Here we can see the difference between a healthy inner ear and an inner ear affected by Meniere's disease. There has been numerous theories as to why these sacs become too full. Among these ideas is one that discusses fluid and salt regulation within the body. Salt dysregulation could be the underlying cause of this. This is because of the salt aquaporin or salt pores located throughout the body and in the inner ear. When there is a malfunction in the transport of water, the pressure in the inner ear is affected. This can set off episodes of vertigo as the labyrinth reacts to what it perceives as imbalance because of poor fluid regulation. Of course, the symptoms leading to abnormal endolymph volume regulation are likely to vary among patients. While there is research suggesting that endolymphatic hydrops could cause Meniere's disease, the research is not well supported yet. One study published in 2015 concluded that while low tone and middle tone hearing thresholds can indirectly reflect the severity of endolymphatic hydrops in the cochlea, no significant correlation was demonstrated between endolymphatic hydrops and other aspects of Meniere's symptoms, such as high tone hearing loss, tinnitus, and oral fullness. Meniere's disease may be mistaken for the cochlear variant of otosclerosis because of the similarity that the symptoms share. One example is specifically sensorineural hearing loss. This disease is differentiated from other causes of vertigo by its other 4 additional symptoms. These include episodic dizziness characterized by spinning, inconsistent, low-frequency hearing loss, aka sensorineural hearing loss, a feeling of fullness in the ear, and tinnitus. While vertigo may occur with cochlear otosclerosis, it is extremely rare. This is helpful diagnostic knowledge when trying to determine if a patient has cochlear otosclerosis or Meniere's disease. Pure tone audiometry and a glycerol test are important audiologic assessments in investigating treatment options for patients with Meniere's disease. Pure tone audiometry would test for thresholds since a symptom of this disease is sensorineural hearing loss. The glycerol administered in the glycerol test helps absorb excess endolymph. Since endolymph hydrops is suspected to cause considerable fluctuations in the amount of fluid in the inner ear, this test is important in determining the extent of the absorption. This is a sample audiogram displaying typical sensorineural hearing loss associated with disease. The right ear is clearly functioning better, as seen in the red, and the left ear, the marks are in the blue, is experiencing some hearing loss. Most often we see audiograms showing mild or moderate low-frequency hearing loss. Patients may experience high-frequency hearing loss later on. We can see this on the next slide. This is typical of a patient with late Meniere's disease. Now this is a different patient, so in this case the right ear was not functioning better than the left this time. As you can see, the hearing loss has worsened to severe hearing loss in the right ear. I'm going to discuss a couple treatment suggestions for those with this disease. Oftentimes the treatment and rehab options cater more to the symptoms rather than the causes of the disease. This is because of the mystery of this condition. The cause is still unknown to us. Self-care options include changes in diet, such as lowering salt intake, and this is because we aren't sure if endolymphatic hydrops are a result of overproduction of fluid or under absorption. Hearing aids may lessen the hearing loss that patients experience as well. Medications may be used to lessen the effect of the symptoms such as vertigo. Vestibular rehab therapy, or VRT, and gentamicin are two treatments that may also be considered. The use of intratympanic gentamicin is to weaken vestibular signals to the point that they cannot cause vertigo attacks anymore. While this is an effective treatment, it comes at a cost. There is a high risk of further hearing loss. A study recently published in 2017 gives a more hopeful outlook though. Chiropractic care may help in lessening almost completely the gloomy symptoms of Meniere's. A 40-year-old woman presented with Meniere's and a misaligned neck, and here's a portion of the results. Within 2 weeks of treatment, the patient's tinnitus had resolved, and all other symptoms, including vertigo, were improved. The patient's headaches, neck pain, and vertigo were subsequently resolved within 3 months of treatment. Meniere's disease is one of the more mysterious of the hearing disorders. New research is beginning to gain more support though. The cause may be unknown now, but it might not stay hidden for much longer.